Hello viewers, this is Priyanka Chakravarti again. We welcome you to Business Conversation. Today we have Dr. Ashok Puranik, who is Executive Director of All India Institute of Medical Sciences. We want to know about AIIMS from him and how the visitors will be benefited from this hospital. So welcome sir in Business Conversation. Sir, what AIIMS is doing currently and how it is positioning itself as a superior health service provider in the region?
Okay, thank you, Priyanka, for having me in your channel. I have given earlier interviews related to who we are, what we do, and what are our visions. To reiterate my position in AIIMS Guwahati, Guwahati AIIMS was officially inaugurated on 14th of April in 2023 by our Honorable Prime Minister Sri Narendra Damodar Das Ji Modi. And since then, 15th of April 2023, we started our OPD services. Our OPD loads, we are running 34 departments of OPD, medicine, surgery, ophthalmology, ENT, psychiatry, dermatology, all those things, right from 15th April of 2023. And then every day, almost 3,000 footfalls are there. Minimum 2,000 patients are attended over there. The unique thing is that we follow the digital attendance and digital registration of all the patients. And we insist on registering first. And there is only one-time registration of 30 rupees along with their book if electronic things are lost and people are not able to access it. Otherwise, the registration has got the advantage of you have through the portal, your complete information gets stored and your all the investigations also gets stored and you can access it from anywhere. That's the very unique thing right from the day we started with that. So we have catered almost 5 lakh patients in our OPD already. And more than 5,000 inpatients admissions also. We started with a little bit of beds in 2023 with the trauma services, some emergency services. We had problem of not having a CT scan that particular time. And our building was not particularly ready. Now the building is ready and it is about to be commissioned, our inpatients department I'm talking about. So at the moment we are running 205 beds, inpatient beds, running 3 operation OT, which continues almost even into the emergency hours also. We have performed more than 1,700 operations in this less than 2 years time, which is another very, which is humanly, unless you are dedicated and passionate, those numbers cannot be reached. So we have touched those numbers also. So we are doing all kind of emergency surgery related to the general surgery, orthopedics, head and neck cancer, thyroid surgeries, hemiarthroplasty, a little bit of joint replacement, most of the fracture fixations. And we have a team of a neurosurgeon also. They are doing whole range of the spectrum of neurosurgery also, including the awakening brain surgery. Ophthalmology, we are doing extraocular surgeries at the moment. Soon from next month, we'll be adding cataract surgery and all that thing. You see, it requires a very long time to get all the equipments at a time for the various departments. Having a skilled person into the place, that it's a mammoth task. And any institute of tertiary center of like AIIMS, which eventually will have a 750 plus beds and 40 odd departments running with those full faculty. It's a very challenging task and it takes minimum say 7 to 8 years, maximum maybe 10 years, So in that way, we are making a very, very fast progress. We already started our postgraduate program in January 2024. So third batch of postgraduates have also joined us. Almost 200 postgraduates are there with us. And then we also started PhD program. We established a yellow fever immunization center. We have started addiction center treatment center for the addiction, drug addiction and alcohol addiction, all those things. Then we further added another center for those neurologically challenged children. So these are the unique facilities which is in one roof, and your next door facility in Guwahati, in Changsari, where we are located. So we are growing very fast. And in coming days, we'll be adding more beds. I'll be opening up another 5 modular operation theater, and then our efficiency will further increase. We'll be able to offer more services to the people. CT is under installation, and very few weeks time will be. So this all things I'm going to declare publicly. I have been restricting myself not to really announce prematurely, because my building was not ready. I was not having CT. I was having a less number of faculties, but still, uh, we faced a lot of deficiency of few specialty like endocrinology, oncosurgery, radionuclide facilities, nephrophysicians. And those gaps we are trying to fill up through the visiting specialists from the other AIIMS. So I'm working on multiple fronts to equip our center as early as possible to deliver the best health delivery to the people. We are very good in research also. We got almost 150 projects worth of research, 150 numbers of research. We call it, when we fund it, is call it intramural. When you get a funding from Department of Science or from the Indian Research Centers, ICMR. So that is called extramural. So we have a very government funded research also going on that is related to the sickle cell anemia, maternal health, child health, community health, psychiatric problem, drug addiction problem, the health care of those tea gardeners, health care of those silk weavers, health care of those bamboo workers. So we are trying to reach to the community to find out what is ailing them and where we can do the improvement. We are already running, as I said, a full-fledged immunization center for the children. And other best thing is that in AIIMS, when somebody, people from the poor strata or people who get free rations, those people are automatically, they become eligible for Bharat Ayushman Yojana, Pradhan Mantri Bharat Ayushman Yojana, through which they get free treatment.
Okay.
So up to 5 lakhs rupees of. So our treatment is really very, very economical, and for 80% of the population, it is free of cost. They have to just walk in, they have to just get registered, get diagnosed, get admitted, and they don't have to pay a single penny. So right from the food, I mean to say diets, their bed, their medicine, their operation, their implants, everything is free of cost.
Okay.
That's the beauty of this particular institute. And our primary duty is to make doctors and the nursing officers.
Okay.
We are the doctor making factory, nursing making factory, the health workforce. We equip, we skill them, we teach them, we make them, worthy to work in health sector. So we are already into it. Our 5th batch of MBBS is already they are appearing for the examination. Soon they'll be going for the internship from the month of June, July this year. And as I said, 3rd batch of PG is already running. We have also opened the nursing college also, where 60 nursing, BSc nursing nurses are taken, and their classes has started last year, August. So this August we'll be receiving the 2nd batch of nursing training also for the BSc nursing training. I have the best equipment in our radiology department, where we can, and I have the persons who will be working behind these machines. They also need to be very, very expert. If machine only doesn't make a difference. But I have a very trained group of specialists who removes clot from the brain, who blocks those aneurysm which is about to rupture and which will be causing a brain hemorrhage. So we are giving a lot of stroke care, head injury care, and neurologically vascular. Most of the problems are vascular in nature. So those problems are just treated by passing a catheter through the groin or through the arm, and you reach the brain and you sort out the problem. So I have an interventionalist doctor who are very much expert, and every day almost 3 to 4 cases of such cases are happening, which is another very kind of yeoman service this group of young doctors are providing in the Department of Radiology. We also started doing angiography now, and we have the whole range of newer equipment and the gadgets required for running any tertiary care hospital. We are running drone services to the far-flung area. We integrated yoga and alternative medicine also. So we are trying to, make it this. Certainly, it's a unique in its way in medical education, in clinical care, and the medical research.
Okay. So, like, there are many hospitals in Northeast region. So, how AIIMS is different?
You see, as I said, we are certainly different in providing good medical education, world-class medical education, because we stick to the syllabus, the delivery, the kind of faculty we choose, who are our trained teachers, who has skills of teaching abilities, research abilities, clinical care abilities, So they go through the rigorous selection mechanism that makes them apart. So, and then we enthuse those discipline also, that the class should run in time, examination should happen in time, examination pattern, the question making, everything is a rigorous process. So we follow whatever National Medical Council directs. Though we are autonomous, though we are free to take our own decision and modify the things according our needs, but we follow the international standards of teaching, skilling, and examining, So this makes, and as I said, clinical care, we are updated, we follow the protocols, and especially it consists of basically medical safety is a prime importance, and our faculties are really trained and knowledgeable and expert in their particular field. So the delivery of clinical care has to be also very excellent and world class level, at least, because in the era of the internet, what's happening in America and what we are doing over here. So on education, clinical care, research, we try to match those standards. In the world, people know that this particular medicine is dangerous. You should not use this particular procedure is unsafe, so you shouldn't be doing, or you should be modifying the things way, or you should be adopting the modern technology and modern method of like uh, safety in laparoscopic surgery, safety in pre-operative preparation, the pain control, the safest pain medication, all those things. So we try to match those things. So the safety is our prime importance. So that makes us different. And as I said, we have integrated the drone services, yoga and meditation, and alternative medicine, adapting to alternative medicine, then doing research on the tribal health and their tribal medicine, also researching on those things. So we are working on multiple front. Uh, I keep bragging about this, like nobody thought of having a yellow fever immunization center in Guwahati. For 15-20 years, people have been going to Delhi and Calcutta to receive a jab of yellow fever vaccination while traveling to South Africa or South America. You need this particular vaccination is mandatory. So when we opened last year, November, we started yellow in 2024. Rather, no, November 2023. We started yellow fever vaccination center. You can just walk in and have injection. For that, a person has to travel to, get an appointment, travel, so much of money, so much of time, everything is lost. So now in Changsari, in AIIMS, it's just your next door facility where in coming years you will be getting advanced critical care, all ICU care, stroke care, complex cancer care. Eventually, when the hospital functions fully, that time certainly, uh, I have a imagination in 2 years' time we should have a specialist and all the armamentariums ready for the renal transplant and liver transplant. That's the ultimate. That will be the ultimate achievement. That is my target. In fact, at the moment we have 105 faculties. Next week I'm having interview for another 80 faculty. So I'll be picking up few more expert who will be joining us to our expert team over here. So it's a gradual process, as I said. So step by step, we are making progress.
Okay.
Yeah.
So now we are really interested to know what are the medical research happening here and what kind of innovation AIIMS is supporting.
You see, innovation doesn't happen in one day, but innovation can happen in new drug discovery. Innovation can happen making a new equipment or new vaccines. We are trying to work out on a newer vaccine for great snakes, where our available anti-snake venom doesn't work, especially in northeast area. There is a typical different type of snake, and those available anti-snake venom doesn't work. So we have collaborated with the other teams, and we are trying to develop that newer anti-snake venom. So similarly, people are trying to formulate new medications, new to decrease the side effect. We have a pharmacovigilance kind of a thing, and people making a new 3D implants, something like that. People keep discovering newer things that is getting patented also. So we publish this all in our international journals, and then when somebody is doing something newer and unique, that gets patented. So we register on that. Like we are working on one team is working on developing a kind of cardiac massage device. Through the laparoscope, it will go to the chest. You open the pericardium where the heart has gone to sleep, and trying to wake up the dead man or dead heart or stopped heart to make it alive. So these are the project which we are working.
Okay.
Yeah.
So as it is almost new hospital compared to other hospitals, so what infrastructural developments happened recently?
You see, it's a 200 acres complex, and 100 acre is utilized for construction. We have a girls hostel, boys hostel, nursing hostels, and their dining hall accommodating almost at a time 400 dining members. We have a PG hostel of 80 people, which is full now. We have a canteen. We have our own auditorium, which is functional. We have a guest house of 34 rooms that is also functional. We have a complete AIIMS building. It is again functional with the Ayurvedic doctors and the naturopathy doctors and the yoga expert. We have the complete OPD building uh, being utilized. We have the complete lab services, radiological services, blood transfusion services. Blood transfusion services are another feather on cap. You know, it takes a time and takes a while to start. We are about to get a license, full-fledged blood transfusion center, and we already started accepting postgraduate students also. And our IPD building is ready, which is supposed to be ground plus 7th floor. So ground plus 5 floor, we are taking this particular in coming weeks. And as I said, I'll be adding 5 functional OT. Eventually, I'll be having almost 20 functional OT. But at the moment, we are running 3. I'll be adding another 5. So it's going to cater all kind of surgeries related to the urology, neurosurgery, orthopedics, ophthalmology, ENT, general surgery. So all kinds of gynecology, you know, the pediatric care, neonatal care. So I have experts for all those things, and we are already running these services.
Okay.
Yeah.
So these days there is a lot of discussion on AI, data technology. So how AIIMS is working on this, or how AIIMS is taking opportunity with this kind of technology?
Okay, so like fewer machines which we in the process of acquisition, where like there is a slide reader for the cancer diagnosis. So the machine tells you. The AI is basically the function of human being transferred to the machine. Machine does the human work. Of course, it is made by the human, but it has got an auto capacity of based on your data you are feeding. It assesses the data and it gives the result also. So it has got a processing abilities and decision making ability. So in our ICU, we are going to be equipped with AI driven technology, wearable technology. You know, at one center, you know that which patient has gone bad, and the specialist at home will be also be alerted. All those things are being already incorporated into the machines. And like our radiology, we are in the process of acquiring a system called picture archiving and communication system PACS. Through the so we generate so much of data every day. Those data will be stacked, it will be analyzed, So we'll be creating automatically, machine will be accepting those data, and then in future will be, there is a already a lot of things which has been invented. If there is some newer findings, that will come out through the research, and then it will be incorporated into the AI. So it's an ongoing process. Data driven technology, okay, one. Two is we are going to incorporate this particular things of collection and gathering of data, analyzing the data along with the or a collaboration with the IIT. So we are going to, IIT is offering a course on data analytics and AI. So people who are from the medical and mathematics background, they will be taught 2 years of medical exposure and 2 years of engineering exposure. And at the in their final semester, they can branch out to become a data scientist, data analyst, or AI expert, or they can join biotechnology, nanotechnology, genomics. So there are so many branches are being merged together now. This is the time where in your operation theater only surgeon and anesthetist is just not required. You require a image analyzer, you require a data scientist, you require a genomic expert, you require a biotechnologist, you require a expert who is a expert in a protein synthesis and protein analyzing, things like that. You require an histopathologist or onco, the people who are trained into that particular domain. So it is going to be, the things is the scenario of this treatment, of modern treatment, is going to change a lot, you know. And then so many machines which are coming related to the augmented reality, virtual reality, mixed reality into the training. Yeah, I just forgot to tell you about that. We have recently established a advanced simulation center where one can practice in advance on those mannequins and high fidelity mannequins where you get the actual feel like you are doing it on the living object like that. So we established a advanced simulation center also. That is good for the transition of the newer doctor directly to the operation theater. So first you get trained in the simulation center and your learning becomes fast, your accuracy becomes very easy, and then you already have witnessed the thing just like actually happening on a human body. So rather than experimenting on human body, you experiment it on mannequin first, and then you go to the practice along with your senior into the learning process. So this is a very unique facility. Very few centers have got advanced simulation center. So we are having that. In future, we'll be doing all this, taking up study on genetic patterns of the disease, cancer disease, congenital diseases, diseases which is found in the newborn. Then we are establishing a rare disease detection center. So we are working on multiple fronts. What other AIIMS like advanced place like established AIIMS like AIIMS Nagpur, Delhi, Bhopal are doing, we'll be doing the same in a few years' time.
Sir, has AIIMS collaborated with private hospitals or private units for medical care? If yes, what kind of collaborations are there?
We being the government organization, we have a clear-cut norms of how we function. Private people have their own dynamics, but it has been found that most of the time when people exhaust their funds and when people become really moribund, many times we do get a request to accept those patients, and we do accept them, you know. And in future, it will be really, I think that we should be open for communication with the other centers, that they should discuss with us in advance for especially the intra-hospital transfer. That will be really a very kind of a good public campaign. Through the good public campaign, we can really achieve this. So far, with the government hospital, especially for the research purpose, we have the collaboration with the NIPER, our next door neighbor, and with the IIT.
Okay. So has AIIMS collaborated with startups, or are you giving any opportunity to startups to collaborate with you? Because many people would like to associate with you. So if yes, what kind of collaborations are there?
We are in very nascent stage of developing. In future, certainly our clinical trials and research might come out with the findings and the innovation, which is good for the public use. We call it translational research. that's the time we'll be equipping or opening up bioness facilities and incubations over here. This kind of thing is already existing in IIT. Since we are new, we'll be establishing it gradually. And as I said, we are working in tandem with the IIT and NIPER. So it is quite a possibility that soon uh, we, we can piggyback on them.
Okay.
Yeah.
So as we know that majority of the people go outside Assam, outside Northeast region for better treatment, there's some kind of trust deficit. They feel that if they go outside, it will be better for them. They can get better treatment.
Yeah.
So will AIIMS be able to do away with such thinking that good facilities
Yeah,
are
so
not
Priyanka, as
available?
I told you that like I'm running 205 beds at the moment, and I'm supposed to be running 750 beds, which might take 2 or 3 years to develop into 750 beds, having all the equipments, having all the expert people and skilled health paramedicals and all those supporting people. So it's just matter of few years. People will not be going to those, will not be required to travel to any other cities because all the advanced facilities will be available here, all the advanced care will be available over here. And if I am not wrong, people from the neighboring countries will be coming to this place.
Okay.
Yeah.
So we have seen that AIIMS is quite far away from the main Guwahati city. It takes a lot of time, no? So do you think it will be helpful to have a center here? Don't you think there should be some other centers or some, departments there so that
Yeah, so we are already, I think there is another Brahmaputra bridge is coming, and that is going to make a huge difference in the saving the time and the travel. So, and that will certainly going to bring us a lot of patients. Instead of going to any other center, people will come to the AIIMS Guwahati. That much I can tell you. We are already running a bus from city bus that I had requested from your Assam Transport Corporation, and they agreed. So we are running a bus for at the moment few patients, and our staff is using that particular bus. So more buses are required. I'll be requesting to the concerned ministry for providing more buses, and I've seen in USA people run free buses from hospital to railway station, hospital to airport, and all main public centers. If some philanthropist and some corporate social responsibility people come forward for such kind of services, which I'm trying, as I tried, we are already got a bus from Assam Transport Corporation. So similarly, those facilities can be extended, and certainly AIIMS reaching AIIMS at the moment is little difficult because it is almost 15 kilometers from Brahmaputra bridge. Okay, so certainly a little bit of transport facility government has to think about extending to the people.
okay. So what are the challenges AIIMS is facing currently?
Challenges, I must say, you see, getting a trained manpower is a real big challenge. Now I need a electroencephalogram technician. I may be requiring four, but I may be getting one or two. I need a senior lab technicians. They are just not available. Health industry is booming so fast all over India that there is a crisis of trained manpower. Similarly, at faculty positions also, as I said, getting a endocrinologist, getting a nephrologist, getting a radionuclide specialist, it's a really challenging task. I also don't have, but I'm expecting once we develop a little better, people will be flocking to us. So uh, getting a trained manpower on certain specialty is a big challenge, and it will remain a challenging situation for whole India because the number of trained people are less. The faculty positions are more, but trained people are less. So there is a um, supply and demand gap is there. One is this challenging. Second challenging is like local people has got a feeling that they should be only employed over AIIMS. Of course, housekeeping or lower jobs for multitasking purpose, we can take them. But for, as I said, having a expert or technical know-how and having trained into those are very, very rare to find. So people, there is a little misunderstanding in the air that they are not getting the job and people from outside is being brought over here. This is a central institute funded by the center, and most of our permanent vacancy comes through the competitive recruitment examination from all over India. So people have to understand that this is a central institute where best people are picked up from the all over the country. For temporary jobs, yes, 99% of the people working in security um, and temporary manpower and housekeeping are local people only.
Okay.
And this AIIMS creates a lot of jobs for the people. Thousands of jobs are offered. At the moment, we are having around 170 security people who are local people. We are having around 150 housekeeping people. They are local people. We are having another 200 plus manpower, and they are local people. In coming days, we'll be recruiting more. So more departments open, more floor opens, will be requiring more people, more transport, more dietary services, more medicines, more consumables. So the AIIMS becomes a brand by itself, and it creates a business like anything. And as I said, if people take up this health subjects for their future employment, that will be a very good option for people, because there will be always a demand for the trained health force manpower.
Okay.
Yeah.
So lastly, we'd
Mhm.
like to know where we would like to see AIIMS in the next 5 to 10 years. Like, what is your vision?
Next to 5 years, certainly it will be a regional center of excellence in this particular northeast sector, where your neighboring country will be coming in a chopper, in a drones, or in an aircraft for the treatment to this particular hospital. This hospital will be like AIIMS Delhi in those 5 years' time.
Okay, so
Yeah.
there's a lot more to see. So viewers, you have learned a lot from sir. So it is really interesting. So we can see that more and more people will come to AIIMS for treatment, and all the challenges that is going through, like distance, like skill manpower, as sir has said, we are sure that this will be over soon. So thanks again. Keep watching Business Northeast for this kind of interviews, news, views, all linked to the business of this region. Thanks again.
Thank you very much.